Good morning to everyone. Myself Dr. T. Arun Kumar, Department of Chemistry, Essence College of Technology. Today we are going to see about the topic called as autopsy and biopsy, Unit 1, Cell Degradation and Repair. So first we are going to see about what is autopsies, that is a postmortems, to find out why someone has died. A biopsy is a medical procedure that involves taking a small sample of tissue so that it can be examined under a microscope. A tissue sample can be taken from almost anywhere on or in the body, including the skin, stomach, kidneys, liver, and lungs. The term biopsy is often used to refer to both the act of taking the sample and the tissue sample itself. So the image showing the autopsy and biopsy. So biopsies can often help diagnostic or rules out. Example, cancer, peptic ulcers, ulcers affecting the digestive system, hepatitis, inflammation of the liver, kidney diseases, endometriosis, where cells that usually line the womb are found elsewhere in the body, specific infections. Types of biopsy include scraping cells, removing cells from the surface layer of tissue, such as inside the cervix, neck of the womb, as a part of cervical screening test. A punch biopsy for diagnosing skin condition, usually a specific instrument to punch a small hole in the skin to obtain a sample. The image shows the scraping as well as the a punch of biopsy.
Tissue sampling of the renal lesion is performed under image guidance, commonly CT or ultrasound guidance. It is often performed on outpatient basis. The patient lies on the procedure table. The initial CT images are obtained. The location of the lesion in the kidney is determined. The biopsy device cannula entry site is marked on the skin. Then, the access site is sterilized. The access area is covered by a surgical drape. The skin and renal capsule are numbed with a local anesthetic at the access site. A very small nick may be made in your skin to make it easier to pass the needle into the renal lesion. Then, the tip of a cannula is placed within the renal lesion under CT guidance. The biopsy device is prepared and then advanced through the biopsy cannula into the lesion. Subsequently, multiple passes are performed to obtain required tissue samples. The entire procedure usually takes between 30 to 60 minutes. At the end of the procedure, the biopsy cannula is removed and pressure is applied to stop any bleeding. Subsequently, dressing is applied at the opening on the skin.
A needle biopsy, a special hollow needle guided by ultrasound or CT scanning, is used to obtain tissue from an organ or from tissue beneath the skin. An endoscopic biopsy, where an endoscope, a tube within a camera at the end, is used to remove tissue, such as from the stomach during the endoscopy. A diagnostic procedure to look inside the stomach upper gastrointestinal tract. A excisional biopsy, where surgery is used to remove a larger piece of tissue. Fine needle aspiration, using a needle or syringe to obtain a sample of cells, example from the thyroid or breast lump. Thank you.